What we're going to be looking at now is loading of the quadriceps tendon in long axis. So what we're going to do is we have the patient seated here, knowing that we're not going to be able to look at the full quadriceps tendon in long axis because of the 4 contributions. But what we're going to do is we're going to have the patient sit down. We're going to have the untested foot standing in front to provide resistance. The toe is going to be up against the heel of the tested section. I'm going to find my bony landmarks, which are going to be the patellar tendon. And what I'm going to ask my patient to do is try to raise the affected side through the planted side. So raise your foot up and relax. And recenter and try to extend against resistance and relax. Now what we're going to demonstrate is a second method for loading of the quadriceps tendon, which does not involve passive resistance. I'm going to put the transducer over the long axis of the quadriceps tendon. I'm going to get my bony landmarks in view, which is going to be the patellar tendon, the suprapatellar fat pad, and we can see the condyle of the femur. And now what I'm going to ask the patient to do is just to go ahead and extend the lower leg out. And back. And extend the lower leg out. And back. Now I'm going to demonstrate the technique for evaluation of the patellar tendon with passive resistance. What I'm going to ask the patient to do is put the foot of the unevaluated side flat on the ground. I'm going to ask the patient to put the toe against the heel of the foot flat on the ground, so the side that we're going to evaluate. I'm going to put the transducer right over the long axis of the patellar tendon, making sure that we keep the proximal patellar tendon in view. And I'm going to ask the patient to try to raise their foot up against resistance and relax. And up again and relax. Now I'm going to demonstrate a second method for evaluation of the patellar tendon under stretch. That is, this time I'm going to put the transducer over the proximal patellar tendon, and I'm going to allow the patient to extend the leg without resistance. The procedure is going to be the same as with resistance. I'm going to put the transducer in a long axis over the patellar tendon. I'm going to be evaluating the proximal part of the patellar tendon, so I'm going to keep the patella in view, and then I'm going to ask the patient to slowly raise their leg up and back down. And one more time, slowly raise the leg up and back down.